All right, and we're live. Dos Dientes, episode 2. Here we go. We got Alexi in the background.
Hola.
There we go. Okay. That's that recording. All right, we got here. Charlie joined, Lucy Lou joined. Here we go. The rest still hope asked the first question. By the way, guys, this is Dos Dientes, episode 2. We're driving home from our day. We do oral surgery and some general dentist offices in Westchester, and so we're driving back. It's like a 2 to 3 hour drive back. Not too bad today. We left a little later. It was like an hour and a half, hour 45 minutes. We got about a half hour, a little less than a half hour left, so we're going episode 2 of Dos Dientes. And the top 10 listeners, by the way, top 10 listeners who stand the longest, we're giving you guys a shout out in the caption in full length. Here we go. Full length version of the recording on YouTube and podcast. All right, so let's get going here. The Rest Still Hope 2026 asked, "Hey sir, long time no see. How's everything?" Everything's good. We're cruising. Had a good day today. It was a half day, 12 to 5. I think we ended like 6-ish. It was good though. It was good. We had only a handful of patients, but good cases. Like one was going to be a sinus lift, ended up not being a great candidate. Opened it up. But yeah, everything well. I should turn on TTS. What's TTS? B?AD said I should turn on TTS. What's TTS, guys? If someone could let me know what that is. I'm gonna, for the future ones, I'm gonna have to get the microphone on the other side because it's like blocking off your. So I gotta get you in the video. It's like blocking you now. I don't like that. Let me adjust this right now. We're getting questions. Let's keep going. Okay, I'll adjust this for the next one. Okay. All right, I'll adjust that for the next one. Let's keep it going. So next in the live chat we got Gotti said, got number 1 extracted yesterday, but I quit the yart months ago. A win is a win. Well, congrats. A win is a win, right? Sometimes you just gotta quit the yart. I don't know what a yart is. I don't know what a yart is. Gotti, what is a yart? Let me know. MZ Love Viela said, hi, how to get my maxilla on point? Well, why isn't it on point? What do you have? Do you have like a recessed maxilla, or what's the deal? Arsh Malo said, are you a doctor? I'm an oral maxillofacial surgeon. And Alexia is my assistant. She's actually a trained dentist in Mexico. And so we work together here doing oral surgery at offices. Like I said before, we work at general dentist offices in Westchester on Thursdays, and we do oral surgery for them. So yeah, let's keep it going. 415D2 said, why did you change jobs? The other job had a different philosophy than the philosophy I was looking for a long-term career, for a long-term place that I wanted to work at, for a number of other reasons. But yeah, looking for a partnership track. I wanted to have a good office setting, good culture environment is actually really important, and I think people don't talk about that enough. Like, everyone knows it's true. You want to be excited to go. You want to have a good team. You want to have good culture in the office. But like, how do you actually get a good culture in the office? There's so much that goes into it. But we could get into that if you want. But yeah, ultimately, change jobs. We change jobs because we're looking for a better opportunity, better philosophy, closer to something that we could do long term, that we enjoy doing. L2 King 1 said, do you have a girlfriend? I have a fiance. Yeah. She is at a work event in Orlando right now. Comes back tomorrow, and our wedding is planned for January next year, 2027. So yeah. J_.J1. Are you driving? No. Dr. Alexi is driving. Alexi's driving. Yeah, she's over there. She's driving. No. Marshmallow. Chad said, what's good? What's good, Chad? What's up, Chad Meister? Detailing_pro 43. TTS is text to speech. People donate to send voice texts that speak through a speaker. Text to speech. People donate to send it. Donate to send it? Sure, yeah. Do it. Yeah, however that works. The Rest Still Hope 2026 said, at Jay, no, he's not driving. No. This would be ridiculous. It's ridiculous as it is. But I know Gary Vaynerchuk would be proud, and it's fun. Here we are. This is we are the DIENTES. This is going to be our brand. We got a logo that's 2 teeth, and yeah. So we're going to do a little show on our drive home from when we do oral surgery for the offices in Westchester. Yeah, why not, right? So this is a little fragment of our life, of our day, and it's like this it makes it exciting. You know, we get to talk about what we did during the day, and yeah, I don't know. This is fun. This is fun. This is so much better than the last opportunity. I think I said that on the last episode. So let's keep it going. I don't want to get into that too much. Marshmallow said, OMG, I just checked your page. A maxillofacial surgeon, WTF. Yeah, dude. Chad said, what do you think of the 3-year programs for dental school? I think they're fine. If you could get out 1 year earlier, do it. I mean, I did the 4-year oral surgery residency instead of the 6-year because, you know, the 6 year's great. If you want to get your MD, it's fantastic, right? The MD degree is great. However, for the oral maxillofacial surgery that we do every day, you don't need your MD for that, right? And you graduate doing the same things. It can be beneficial if you want to you need an MD if you want to do full body cosmetics, okay? But you don't need an MD for anything else in oral maxillofacial surgery in the United States, right? So, similar to your question about 3-year programs in dental school, if you could do it, right? But my one question is, I didn't go to a 3-year dental school, so I don't know what the experience looks like clinically. I'm sure you're going to get just fine of a didactic experience, but the real question is, like, clinically, are you getting enough experience? Are you getting enough experience doing it clinically? Does that make sense? So, Mo123_30, 63 CBSE score, 4.0 GPA, state school. All right, great GPA. Excellent. You're at a state school. Great. So you're saving on tuition. I'm sure the clinical experience is great. 63 CBSE. Let's see how many interviews you get. I'm sure you'll get some interviews, so that's good. But if you don't get enough interviews, or you don't get accepted, or whatnot, I would suggest maybe we consider retaking that CBSE. You know what I mean? To get to work on that score. Tyrese Loves Cats said, why'd you leave your first job? Yeah. We're looking for the philosophy that aligns more with mine. Better culture, we had a great team, but the culture and the work environment, which generally stems down from leadership in many areas, right? And not all the time. And sure, other people may have different opinions on it. But yeah, in many cases that I felt was that situation was, I think culture needed to be better. And there was no long-term career for that. Like, there was no partnership track and stuff. So, but while we left, the fact of the matter is, it was termination. We were terminated. So I was called in on a Monday. Oh, we hear you're looking for other jobs and trying to take our staff. I couldn't take the staff. That was in my contract to not do that. But, if you're in a job that, you're looking for something more, something different, you're allowed to look for jobs. So there's nothing wrong with that, right? And so they were like, all right, you have 60 days to find another job. And then 4 days later on Friday, they handed me my papers to terminate me from that job, and they terminated Alexi as well. So, yeah. which is such an interesting thing. I mean, think about this. You're telling someone that you're terminating them, you're firing them because they're going to take staff, and then you fire staff? Anyway, I don't want to get into this much more than that, but think about that, you know what I mean? Kind of sounds like a contradiction to me, but help me put 2 and 2 together. Maybe I'm wrong. Victoria Victory said, my daughter starts dental school in August. How do we best support her? Okay. Always encourage her and support her whenever she's studying. Always say, hey, we know we have this family event, we have this birthday party, we have this holiday on the weekend, but we totally understand if you need to study. And many times she's going to need to study, but if she can, here's the thing, don't, some of my parents would be like, you could come to this if you want to. Don't do that. Don't make someone feel guilty to come to some kind of event or something. Of course I want to. You think I want to be sitting in my room or in the library alone studying on a holiday or when it's a family member's birthday or family event? Come on, of course I want to. But there's times where you need to make the sacrifices and be studying instead of You see what I'm saying? You see what I'm talking about? Like, you need to give them space. You need to give them room. You need to let them make the decisions, because maybe they have literally, there are days where you have 5 finals in one day. Alexia, did you have that in dental school?
Yeah.
Like, literally 5, right? And
Yes.
you need to study for multiple tests on the same day. And it's very difficult to divide and conquer. It's a lot. So you need to give them space. You need to give them time. Okay? You need to... That's it. That's how you're going to support them. If they come home, like, I'm not saying you have to do this, but, like, imagine your daughter coming home from having those 5 final exams, and it's like you have her favorite meal cooked without her asking, or, like, ordering out her favorite whatever meal. You know, just having little special nights. And guess what? Like, those nights is going to make her want to come home more. It make her motivated to get that studying out of the way, that whatever out of the way, so she could come home and spend time with you guys, like watch her favorite movie or show, or you know, really just kind of letting her do what she needs to do, because she's an adult now. She's responsible. You need to give her that space, that room for her to do those things. Okay? All right. Ofo Fayella. Wow, where are you taking us? We're just driving home. We're driving home to after our day doing oral surgery at a general dentist office in Westchester. So we're just driving him. eDog580. When were you resident? I graduated middle of June last year, 2025. So from 2021 to 2025, I was an oral surgery resident. Oh, I got to scroll back here to some missed. Evan Duprus, follow the live creator. Thanks, Ev. Where are we? Shar said question. What's up, Shar? What question you got? Curtis said, I'm a pre-dental student. I've been working as an RDA. RDA is registered dental assistant. I really love surgical cases, but I was wondering. What were you wondering, Curtis? Left us on a cliff there. Oh, what was the reason you chose OMFS comparing to general and other specialties? Oral surgery is awesome. Doing surgery is a lot of fun. It's very... Hey, why did this turn off? What? Okay. It's on, though. Hopefully that didn't, like... That's weird. Okay. Yeah, just oral surgery is great. It's great, you know, and as a general dentist, you can do some surgical procedures, you know, so... Wow, we got to go back. Brian Leclerc said, what about starting a practice? Starting a practice can be done, but I don't know. Like, I always dreamed of being in a partnership in a practice as like a partner, whether small or large. Just I always wanted to be a partner. I never wanted to be like alone in a practice. I could do it, but I don't know. I played basketball in college, and that's one of the reasons I went into oral surgery, because on my externships, I loved the teamwork aspect that the oral surgery residents would work together on cases, on getting through the day, on taking call, just a number of things, right? And so I don't know. Could I do that? Yeah. And if for whatever reason opportunities in the future don't work out, that's probably the direction I'm going to have to go. But yeah. No, I don't want to be alone in practice. I want to be in a partnership, and that's where teamwork really comes through. So that's very important to me. I'm a big advocate for teamwork. Where are we now? Hold on, I gotta scroll back because TikTok always moves the chat a lot here. And I'm trying to hold it down with my finger, but it doesn't. It keeps moving. Where are we? It just did that again. It just keeps moving to the bottom. That's so annoying. L2 King 1 said, how is Stony Brook University? Stony Brook Dental School is great. It's a smaller class. It's a state school, so you get state tuition. And they have an excellent clinical experience. They do. They really do. And they also have a great match rate into specialties. So Stony Brook Dental School, while this is not an advertisement for them, good idea. Good idea for a dental school. Yep. You're not going to like it when you go there. It's going to be tough. Depending on your class, it may be good or not. Like, there's a lot that goes into it. But, okay, let's keep it going. How do I choose the current main focus of your live? What? That's really annoying. I just want to be left alone from these notifications that come up on the top. Okay, here we go. Gotti said yard equals the vape or nicotine. Oh, gotcha. Okay, nicotine's no good for you, by the way. Just throwing it out there. Very, very, very addictive too. Careful with that. Freaky Minion Bob 223. Why choose dentistry over ortho or general surgery medicine? Oh, so in the United States, the medical side of healthcare has been very corporatized. Like 90% or more of the jobs, maybe 80% or more of the jobs are in a corporate setting, owned by the hospital system, run by insurances. That's just not... And dentistry is getting very similar, very corporate as well, with these private equity-backed practices buying up everything, and other practices buying up everything, which very corporate. You know what I mean? I'm a big fan of like the mom and pop shop to give patients that feel, that personalized feel. You know what I mean? So let's keep going. Nathan said, I studied dental hygiene in Europe, but I'm thinking about doing dentistry after this. Should I? You could. Depends on what you want to do. I'm not going to tell you what to do. You got to figure it out. You know, you need a shadow dentist, shadow dental hygienist, and determine. You need to make that the choice for yourself. What career do you want to take on for the future? Evan Dupras said, when can I expect my jaw stiffness to go away if I'm currently 6 days post-op wisdom tooth removal? So I don't know I don't know how impacted your wisdom teeth were. I don't know how many wisdom teeth you got out. I don't know how the surgery went, the skill of the surgeon or dentist that took them out. Generally, after about a week, that should get better. However, I've seen it up to 2 weeks. Very rare cases, a little bit longer, but usually after 1 week, it's getting better, okay? STE_ said, when you were an undergraduate, did you get any certifications to work as a dental assistant? I was a surgical assistant after I graduated undergrad. Before I started dental school, I took one gap year and I worked as a surgical assistant. But I was a lifeguard, so I had like the BLS, that's the basic life support, like the CPR certificate. I had another certificate, the lifeguard certificate, so I knew a lot of those. I had them already. Just had to get them renewed, you know? Tyrese loves cats. Just saw an old video of you. You had a crazy long beard. I had an ugly beard. I don't know about a long beard. It was like red. It was like reddish, like very Viking. I don't know. I like Viking stuff, but I did not like that beard. I was like, you know, kind of taking some time off from, but yeah. Anyway, where are we now? Shar said, how long does it take canker sores on the gums to take to heal? It's different for everyone. Could be a week or two. It's going to be different. It's going to be different for everyone, you know? Yeah, so, all right, let's continue here. Wow, we're already at 1.5 gigabytes of storage on the recording at about 17.5 minutes. Interesting to think about. One only Jew said, take my DIT next month. Thank you for your motivation. You got that. You got this, man. Good luck. Good luck. You got this. Nathan said, should I study dentistry after dental hygiene? I'm from the Netherlands. I'm not familiar with the landscape of dentistry or dental hygiene in the Netherlands. I'm sorry, man. Curtis said, I'm a pre-dental student. I've been working as RD at Relive surgical cases, but I was wondering... Oh, yeah, we hit that one. We hit that one. So Lassie said, I just did a wisdom tooth removal. What should I do to prevent blood clots to go away? Pack with gauze. Pack with gauze over those areas so the bleeding stops, okay? Rotate them out every 30 minutes so the bleeding stops. Make sure you're not using any straws, no spitting out blood in your mouth. Just let it sit, just swallow it, whatever you got to do. Don't be spitting out that blood, okay? If you spit out that blood, it will take the blood clot out because of like the suction kind of when you spit, you're going to pull the blood clot out of that socket. You don't want that to happen, okay? It's going to be very painful. Very, very painful. Safi said, how to deal with missing teeth trauma and treatments? Safi, can you give me some more information on that? I'm not understanding. Everyday said, I'll apply this year. What's the minimum number of programs to apply for to get enough interviews? There's really no hard number of that. Just, I recommend, now I know it's expensive to apply to more schools, more residencies, more programs, but you don't want to go through this again, do you? Apply to more, you'll get more interviews, hopefully you get accepted, and you get in this year. The less you apply, the less interviews you get, the less chances you have of getting accepted, okay? It's just simple numbers like that. Guinea pig crazy, 2020 crazy cats. Wow. Wow. I am 2 weeks post-op wisdom tooth surgery. All right, nice. You got this. You're just about there. Hopefully you are there at this point. Cameron Heider said, I really think dental school would be great. Does it feel like doing hands-on work? Yeah. Actually, yeah, that's a good point. I think it... What did you think when you went to dental school? Did you like doing hands-on work? Do you like doing hands work on now?
What do you mean with that?
Like working with your hands to help patients and stuff.
Yeah.
I think it's great. I think it's good. Yeah, so it does feel good, yeah. Mar said, after the 4 years of DDS school, would you recommend residency? Yeah, if you want to go on to further training, yeah, get more experience before you go out into working in the world, you know. eDog580, as an OMFS resident, what did you do in the hospital? Oh, we did a lot of trauma. We extracted teeth. We did implants. We did laceration repairs. That's part of the facial trauma. Taking call for multiple days at a time, sometimes not sleeping overnight, working the entire next day. That's how it was my first year of residency. Yeah, going multiple days, over 30 hours sometimes without sleep. Still doing surgery on people's faces, probably not a good idea, but that's how it was. There are laws to prevent that from happening too. And then after my first year, that didn't happen anymore. What else do we do? Sometimes cancer surgeries. We take cancer out of the head and neck. What am I doing? Oh, biopsies, IV sedation, putting people to sleep to do surgeries. We go to the operating room. In the OR, we work with anesthesia. They put patients to sleep. We did more in-depth, more invasive surgeries, perhaps, things like that. And more. I'm missing so much, to be honest. During residency, we covered 4 institutions. 3 of them were hospitals. We had the private hospital, we had the public hospital, and then we had the VA hospital up First Avenue in Manhattan. And then on the other side of the street was the dental school. So we covered all 4 of those places. Yeah. Bourbon Empire said, should I choose MedPro? MedPro for what? What kind of insurance? Malpractice insurance, injury insurance, like disability? What are you looking for? Evan Dupress said, when can I expect my jaw stiffness? We hit that one. Mo123_30. Thoughts on the 5-year dual OMFS program? You're talking about Case Western. I think it's great. I think it's a great program. I don't know enough about like the people there, the attendings there, the leadership there, but I mean, getting your MD in 5 years, that's a year discount. That's great. No? I think so. Yeah, so. Yudron said, I'm dying in pain. Do I have to go again to the dentist? Well, where are you in pain?
Yes.
If you're in pain,
just go.
Just go. Although, if you're having pain somewhere else in your body, like your toe, then no, you don't need to go to the dentist. But if it's pain in your teeth, yeah, you should probably visit a dentist and see what's going on. Bilbo Ball Baggins. Is your name Pfizer because you made my heart stop? Oh, man. Oh, man, that's bad. Oh, geez, yeah, that's dark. Anyway, let's see. Devin05 said, I'm 6 days post wisdom tooth removal with stitches. Am I able to vape yet? I mean, I can't condone vaping at all, but wait a little bit longer. Just wait a little bit longer. Wait some more days. Wait a few more days. Emily McNeil said, who's in the car? Is she your assistant? Yes. This is Alexia. She's my head assistant. Alexia is actually Dr. Alexia, like I was saying before in the show here, that she's a dentist trained in Mexico. Yeah. And I am so lucky that she's not in Mexico and she's here with me. And today we went to the dentist. We go to dentist practices in Westchester and on Thursdays, and we do oral surgery for them. So we're on our drive home from there. Yeah. And so we're calling ourselves the Dos Dientes. Yeah, we got a logo. What we're going to do is we're going to do headbands and hats to start. If you want to get one. Yeah. So think about that. We're going to get those going in a couple weeks because I'm going to be away the next 2 weeks in Europe. So after that, hopefully we can send it out before, at least get our logo on the scrubs and send that out. And violation warning. Your live is flagged for dangerous activity and challenges. Live restricted for some audience. Your live contains themes that some may find uncomfortable and has been restricted. Dangerous activity and challenges. What? I don't think so. I mean, what? Let's see. The notice is unclear, and I'm still not sure why I got the restriction. My live does not contain the content mentioned in the notice. Correct. Okay, I'm submitting, and let's get back to the show. All right, here we go. Where are we? Bilbo Ball Baggins. You talk too much like a woman. Wow. Okay. All right. Bilbo Ball Baggins. You got a great name. That's so funny. Have you ever seen Lord of the Rings, The Hobbit?
No.
No?
No.
Maybe
never.
in the future. You like action movies and stuff, right?
Yeah.
Do you like adventure and...
I like superhero movies. Yeah.
I think you would like Lord of the Rings and The Hobbit.
Okay.
Because some of them kind of do have superpowers, but it's like an adventure movie, very adventurous and sci-fi. Yeah, I think you would like.
Okay.
I think you would like Lord of the Rings and The Hobbit. Soon. Yeah. Whenever you get a chance.
Yeah.
Hey, it's Noel said, I got my wisdom teeth out like 6 days ago, and now it's all my For You page. This is terrible. Well, sorry about that. Is there anything we can help you with, though? rleaf0621, when can I expect my lower mouth to be pain-free? I had wisdom tooth surgery 2 weeks ago from today. It should be soon. It should be coming up soon. That's 2 weeks is a long time, but it's not on. I mean, it can happen. You know what I mean? It's not common, but that can happen. Emily McNeil said, going to Yeshiva University Dental. Congrats, Emily. Congrats. Yeah, it's interesting because Yeshiva is a new 3-year dental school in New York. New York already has 5 dental schools. We don't really need another one. You know what I mean? There's also interesting because the job market for jobs isn't expanding the way they're expanding dental schools and pumping out more students, it's so interesting. But they're making more money off of dental students than they are doing dentistry. It seems like at many dental schools these days, unfortunately. But Yudron said, I have got a dry socket and I went to clean it out 2 days ago and it still hurts. Is it normal? Whoa, wait, don't clean it out. Just let it sit, put gauze, don't touch it, don't spit out any blood, just let it be. Maxwell Tin said, would you say oral Minox at 2.5 milligrams is generally safe and shouldn't worry about taking? But what are you taking it for? Yudron said, I got a dry socket. Yeah, I got a dry socket. Yep, careful. Don't spit out. Don't do anything with it. I Love Teeth said, how do you manage a relationship in dental school? Is it hard? It's hard. It's tough. Your significant other really needs to have your best interest in mind, the best intention, and understand that it's a very stressful time of your life. Very, very stressful. Okay, so let's see who's next. Wow, a lot of Yeshiva Dental School spamming here. Unknown said, is it really that hard to get into oral surgery as people claim? Yeah, it is very hard. It is very hard to get into oral surgery residency. Ken's said, how long did you take to pay off loans? It depends. Everyone's got a different amount of loans. You know what I mean? So it could take a short amount of time. It's probably going to take a long amount of time. You really need to get situated in a good job situation. And also remember, once you start working, life happens. You might need to buy a car. You might need to get a house. You might need to maybe have a kid on the way, or pay for your wedding. I'm saving up for my wedding in January next year. Weddings are very expensive, by the way. And so we're saving for that. So, yeah. So there's just a lot more than just paying off the loans. It's life has so many more expenses than you realize until you start paying for the bills, the electricity, the water, the air conditioning, the lawn maintenance, the pool maintenance. I could go on. You get it. Lebanon123_ Father Live Creator. Thanks, Lebanon. Lebanon said, is oral surgery not as precise as general dentistry, right? I'm assuming. What do you mean not as precise? I would disagree because, wisdom teeth, especially the lower wisdom teeth, they're right near the nerve, the inferior nerve. And yeah, you definitely need to be precise, especially with those. The upper wisdom teeth, they're right near the sinus. You need to be precise to make sure you're not going to put a hole in that sinus, right? So things like that. Bourbon Empire said, thoughts on MedPro for malpractice insurance? I think especially the first 2 years out, it's 50% off or free the first year and then 50% off the second year. I think it's really good. I was doing malpractice episodes with them and they stopped wanting to sponsor those episodes. So I'm going to look for Omsnick now. That's just how it goes. They don't want to pay for it. I'm not going to, I really like doing it with Dr. Leffler. I think we did 6 episodes, but yeah. So how much time we got? Oh, a minute. We're right here. Okay. All right, guys. We're going to be signing off now. Thanks so much for joining. Dos Dientes episode 2. Woo! We do this on our drive back from Westchester at the dentist practice that we do oral surgery at. And Dos Dientes is going to be our show on our drive back. And by the way, top 10 listeners who stay on the longest, we're going to be giving you guys a shout out in the caption for the full-length podcast and YouTube channel. So All right, guys. Thanks so much for coming in. And we'll see you next episode will be July 9th. That'll be Dos Dientes episode 3. So, all right, guys. Thanks for signing in. We love you guys. All right.
Bye-bye.
All right. Bye, guys. Hit the stop on here.